Now we'd like to introduce you to Tara Wood of Mid-Michigan, just one of thousands of women across the country who believed their breast implants were making them sick.
She decided to get hers removed, which brings us to part 2 of our story on breast implant illness. Here's News 10's Carla Byron.
I just thought they were safe. Everything that the doctor told me, they were safe.
After 6 years of suffering from a variety of different debilitating symptoms, Tara Wood read about breast implant illness on a Facebook page, which led her to plastic surgeon Dr. Amy DeRosa in West Bloomfield.
Thank you for calling DeRosa Plastic Surgery. How may I help you?
Dr. DeRosa says her office sees about 20 patients a week from coast to coast, all women wanting to get their implants out.
Typically they're autoimmune-like related, so hypersensitivity, inflammation, brain fog, fatigue, rashing, so dermatologic issues, peripheral neuropathies, hair loss, joint pain. I mean, it's a whole constellation of things that seem to have a common story amongst these women.
DeRosa also performs an explant technique called N-block.
It consists of taking the implant out, which is the easy part, but actually not even getting to the implant itself during the procedure, whereas you're shelling out the entire capsule or scar tissue that forms around the implant, taking it out of the body contained, and then evaluating it on the back table.
She says this allows the breast tissue to reset to a natural state prior to the implantation. And based on numerous patients saying their symptoms went away completely or greatly improved after removal, DeRosa says breast implant illness is very real, even though the medical community hasn't acknowledged it.
The drastic improvement with simply removing an explantation of their implants, there's no way that I could, as a physician, think that that wasn't a real entity. It's not a real thing.
She says their policy is to no longer take new breast implant consultations until their safety is further evaluated. In March, the FDA recognized BII is an issue that needs further evaluation and understanding, but DeRosa hopes action will be taken.
A warning label would definitely be useful. I mean, we give a huge list every time you go to the pharmacy and get your medication. You have a huge packet of potential side effects, and I think that with implants that should be included.
Wood agrees. After her explant, she says all of her symptoms disappeared.
I did end up going back to my physician, my regular physician, and he ran the blood work again, and my levels were even back to normal. Almost, like my ANA level was so elevated, and now it's more than half cut down.
She says she's living proof breast implant illness is real.
There's too many women out there suffering for it not to be real. And I've heard a million times over that it's not real, and it is.
Dr. DeRosa's office is working with a major hospital doing research to see if the N-block explant procedure helps with reducing symptoms and improving patients' overall health. She's hoping this research will reveal more specific information to what's causing the symptoms, and one day, hopefully, will be published in a medical journal.